time, but we see them play out and exacerbate health inequities, especially right now. So quite simply, like the social determinants of health are the conditions in which we live, work, and play. And so we think about all of the physical and social environments that shape the world around us outside of our individual kind of behaviors and individual factors that shape our health. So some kind of classic examples of social determinants of health are our neighborhoods and all of the constellation of factors in our neighborhoods that shape our health, like park access and green space and sidewalks, and whether you have grocery stores or whether you have a library near you. All of those things are in some ways health affirming. You can also think about your community context in more social ways, right? So do you have good neighbors, a family base to support you? Do you have a good sense of community engagement and where you live and work? Sense of social integration, right? That's the more social factor neighborhood. The other social determinants are things like economic conditions. So where you work, do you have good jobs? Are those safe jobs? Do they pay well? Do they provide benefits? All sorts of supports within your workplace. Do you have paid family leave? Do you have a flexible vacation policies? Do you have a work environment where you feel like you have control and you're able to make decisions? All of those factors are also part of the social determinants of health. And other ones that people think a lot about are sorts of stuff like transportation and housing availability and the quality of housing. And the healthcare system certainly is part of the social determinants of health. Do you have primary care providers, dentists, a hospital facility, trauma centers, all of that? But not only that, but do you have quality facilities? Do you have folks who are competent in your community, for example, like you're an immigrant community? So all of those things are social determinants of health. So what happens when we think about health inequities especially is we know that all of those kind of social and physical factors in the environments in which we live, the work that we have access to, the kinds of schools and environments our kids are in, those are all unequally distributed in our society across many axes. A lot has to do with income and class and wealth, certainly race, ethnicity, immigration status, ability status, gender, any sort of axis of identity, you name it, it's inequitably distributed across our society. So then when we think about health inequities, health is a product of all of our social environments across our life course and behaviors that are shaped directly by those social environments. So health inequities happen because of social inequities. That's kind of the drum that we have been beating on for a really long time. And so that's why social determinants has come so much into the fore, especially with COVID, as well as many of the chronic diseases that we battle as a nation, because we are learning and realizing more and more that it is these social environments that are creating and engendering these inequities, and not really just the individual decisions of people and their behaviors, which for so long has dominated the conversation in public health and medicine. It's changed behaviors that our health changed, and we've done that for 30 years. That's kind of been public health policy for a long time. So now this social determinants of health conversation that we're having is envisioning us to think new and better ways to improve population health.
And I think you beautifully and kind of epitomized what we were talking, Daisy and I were talking about before in this episode of all the things that come before the diagnosis.
Right. And speaking sort of on that note of all of these different factors exacerbating the harmful effects in marginalized communities, how the systems put in place in healthcare right now are not tailored to attend to these needs the way that they should be necessarily.
Right.
Reading up on the city of Chicago allowing the demolition of a coal plant just this April, sending a cloud of dust over a predominantly Latinx area of Little Village, talking about confounding factors. And then we have sort of legislatures or policies that are allowing additional harmful effects to affect these communities. We just wanted to kind of hear your thoughts on that. And also in the article that you co-authored for the Chicago Reporter titled Flatten Who's Curve, COVID-19 Response Overlooks Built-in Racial Inequities, you discussed a sort of 3-step action plan detailing how the local and state governments could more efficiently combat COVID in Black and Latinx communities. Would you maybe touch on these aspects and give us a little overview of this plan? Have any of the steps that you recommended come to fruition?
When all of this was rolling out, when COVID was happening, and we like shut things down, started the screening, sent people home. I was really disappointed as a public health researcher because here we could have had an opportunity to really rethink like how our world worked a little bit, right? We could have thought about and designed interventions and policies and programs that would have really been designed for our most vulnerable, right? Like, let's think about really giving people affordable housing now, or like putting people like, right, housing people in safer places, really giving people food, providing them the economic safety net that they need so that way they can weather this storm and not have to work, right? And so it was really disappointing to see kind of business as usual, right, with COVID. The power plant, for example, being an excellent or a poor case study, right, of that happening, that even amidst, right, this pandemic that impacts your respiratory systems, that we would still demolish a coal plant, right? But, you know, one of my papers I did a while back was on this large immigration raid that happened called Postville, right? And we studied it because it was at the time the largest in the country. But we argued that like Postvilles are happening all the time, all around us, right? Immigration enforcement is happening all the time around us. So right now with this coal plant that was demolished in La Villita during COVID, right? This is an extreme case, right? Of this huge coal plant impacting this place amidst a pandemic. But when the pandemic is over, there are going to be small coal plants demolished all over the place in communities that are disproportionately targeted by asthma and respiratory infections and all sorts of things, right? Above and beyond COVID, right? We are appalled by these extreme cases, but we also need to pay attention to the system that allowed this to happen in these, right? And that people didn't even bat an eye, right? It's going to happen tomorrow again if we don't pay attention. The next coal plant is going to be demolished, right? The next Postville is going to happen. And I had hoped, right, that COVID would make us pause as a country, as a nation, as researchers, and think like, what are we doing wrong here? Like, this makes no sense. And so that's kind of why we wrote that Chicago Reporter piece, because we were just like, we are missing the boat here. And so some of the recommendations that we laid out in the report was to increase testing sites and access to vaccines, because we saw, you know, the places that were hardest hit were not getting access to testing sites. I haven't looked at the data really well. Robert Vargas, he has a project right now looking at the data of testing sites. And I think they've done a lot better in terms of distributing tests and having more testing availability, but we're still not there where we need to be. And what I would really love is for the city to do more testing associated with workplaces, right? So like, why can't we go to these big manufacturing plants? I'm having work done in my building, like to the balcony workers who are like grinding down the metal, to the outdoor, like I think we need to be more targeted in our testing and not just have them at these healthcare facilities. And then one of the things that we argued for was when the vaccine becomes available, that we should target the vaccine to the communities that most need it, not those who can access it, right? Like the celebrities who got access to testing should not be the celebrities who get access to the vaccine first. And then we're seeing now, right, like I'm starting to see researchers roll out, like, we need community members to be part of these vaccine trials, but there needs to be some sort of guarantee that these folks are going to get access to the vaccine first if it works, right? Like, can we think about doing something like that? The other kind of recommendations that we had were, you know, partnering with more community-based organizations to meet the needs of the community members. I've been quite struck with how much kind of mutual aid and things that people are just organizing on their own is continuing to happen. And so I would hope that Chicago is like paying attention to and listening to these networks and resources and infrastructure that is being built, as opposed to kind of, I think, the like nonprofit industrial complex that exists in this country, right? Who has very bureaucratic, has the infrastructure, but might not be in needs of the people, right? So thinking about integrating with more of the kind of grassroots things that are happening. We also suggested that we need better data because we don't understand the full scope of the COVID disparities across race, ethnicity, immigration status because of the data. I think those things are improving, but they can certainly always get better. But I think people are making more inroads and we have less missing data. And then I think the big piece that I've alluded to throughout this conversation was, you know, what other levers can we think about? We still have no kind of economic stimulus, no sorts of the unemployment protections for people or the benefits that ran out, you know, so on. Like, there's still very limited support for people with kids at home who still have to work. Like, I have no idea how people are making it work. Like, quite frankly, I could not make it work if I didn't get my paycheck at the end of the month, right? And I'm sit in a very privileged position. So the fact that we're not even talking about these people who are not making their rent, not affording their bills, and the fact that we're just like haven't even worried about them or mentioned them, like, I just can't even with this country anymore, So we'll see, we will see what happens. I am not optimistic. We're just kind of supposed to grin and bear it. And many of the protests that happened in the spring and in this summer, the many calls for kind of more discussion on like racial inequities and racism in this country was a response. People being upset and mad and frustrated with the system, just kind of throwing them out to die, quite frankly. And that's kind of the message that folks are getting sent right now with COVID. I'm optimistic that we will continue to have these conversations. And I think, like I said, people who haven't been in the social determinants of health world or haven't been thinking about kind of economic policies and taxes and how we need to rethink, this system that we've designed. I think they are coming to the table, but many are still like, no, if everyone just worked hard enough, like they wouldn't have gotten COVID, right? I think that is such a unlimiting conversation that's not realistic with what we're facing now.
I think you said, like, I just can't with this country anymore. And I feel like that's like Daisy and I, like, we're all on Zoom, right? So we're like nodding aggressively. And I'm just
yeah, we're all like all about it. Yeah.
Exactly.
To like, because I know, right, somebody might at me or email me, like, I know they're going to say, right, well, if you don't like this country, get out, right? Or somebody might come at me. And it's not like when we say, I can't with this country, it's like, we should be able to do this. Like, we can come up with getting a package to your door in 2 days. We should be able to solve some of these problems and challenges. It's not that we don't have the money or the resources or the infrastructure to make these things happen. It's will and our ideology and what we think of ourselves as a nation, If there is somebody out there listening who, for example, is like so against this, that's what I'm sympathetic to Trump supporters because he's feeding them what they want to hear, right? Like he's feeding them this American dream that you signed up for no longer is working out. And so I'm going to make it happen for you. And to be fair, that's true. Wages have gone down. People pay so much taxes these days. The middle class is eroding. But it's not that, we take from others to give to you, right? It's thinking about distributing things a little bit more equitably in this country. And that's the conversation I hope that we start to have, right? And trying to align those concerns because we do have, I think, a lot more in common with Trump supporters. Like we do have a shared vision, I think, for the U.S. If we really were to sit down and think about it. I think people's fears have been mobilized in harmful ways.
Yeah, I definitely agree. And one thing also that comes up when I was reading more about your COVID tracking project and the racial data tracker is, why is it that we have to show data and like these numbers for our experience or people of color's experience to be real? Wondering, like, can you tell us a little bit more about that and like where your team's been used and like how it's been hopefully or in the future alleviate some of the harm that's done to minorities?
Right, definitely, yeah. You've asked the kind of existential crisis that I think so many data scientists, population health people, researchers ask themselves. I do all the time. If they don't, they should, right? What are we doing all this research for? Why do we have all this data? Do we need, some of the work that I do is more like stress biomarkers. So we collect people's blood or their saliva, and we get at these like very kind of fine-grained biological processes that show us kind of health disrupting, right? But we don't need a fancy biomarker to tell us, right, that racism or capitalism is harmful for our health. Like we know this by and large, right, without having to do this fancy and frankly expensive science. So we ask ourselves this all the time. Like we know many of the solutions, like do we need more documentation and more evidence? And the answer that I have often for that is data is good because it still provides us more information to think about where to pinpoint our efforts. Like if we only have a limited amount of resources, where do we go first, right? And what would give us the most bang for our buck to make inroads on population health or who's most at need now. And that's why the COVID tracking project is really helpful because it helps us think about like what states are kind of heating up and we need to be paying attention to, or what areas and what communities are heating up that we need to pay attention. Thank you for mentioning COVID tracking. I'm like curious how you found out. I just joined their advisory board, but they are doing the work of compiling all of this data across states because now I think we have a better sense for like how COVID is rolling out across